Coccyx pain, also known as coccydynia in medical language, or simply tailbone pain, can be quite a debilitating condition, most frequently affecting people's ability to sit and making it particularly uncomfortable to sit. There are usually two main groups of people who suffer from this problem. Sometimes it's during pregnancy or post-labor, where the mechanics of the labor and the passage of the baby through the pelvic floor cause strain and pressure on the coccyx and the ligaments and the pelvic floor muscles which attach around that area. So that's one group of patients who suffer from coccydynia. And then the other is people who have a traumatic onset of coccyx pain, most typically from a fall directly onto the buttocks. So that's typically either a fall on a stair, so missing a step and sliding and landing on the buttocks, or sliding on a slippery surface and landing on the buttocks. So the direct point of contact is through the coccyx. Just to orientate yourself here, I have a picture of the general layout and orientation of the anatomy, which is worth having a look at. So that's a view of the pelvis. Here we have the two hips on either side. This triangular bone is what's called the sacrum, and then this coccyx is a small little curly bone on the bottom, which is basically the remnants of your tailbone, and your lumbar spine is located here. The important thing to note here are these complex ligaments which attach all along the boundary of the sacrum, and bind this sacrum to what's called the ilium, which is part of the pelvic bone. So this joint here is called the sacroiliac joint, and there's one of those on either side. And then the coccyx itself, there are strong ligaments that attach from the side of the coccyx into this big bundle of ligaments that attach onto parts of the pelvis. So when there's some trauma which impacts through the pelvis, and particularly with the initial point of contact through the coccyx, although that may be the area that's most damaged, invariably there are some other secondary effects up through other parts of the pelvic mechanics. And that's really what I just wanted to highlight today, because the direct point of contact on the coccyx will often either cause bone bruising or irritation and strain of the ligaments which attach to that area. But more often than not, you will also get a displacement or a change in position of the sacrum. So the sacroiliac joint gets disturbed. So one has to examine the pelvic position, the two big bones that the sacrum and the coccyx are contained within. So that's a very important thing, to check the mobility within the sacroiliac joint. Sometimes that gets jammed or locked, so that's an important thing to consider. And very often there are some secondary effects further up in the lower spine, usually because people are uncomfortable sitting, so they end up having to sit off-centered to try and take pressure off the sore coccyx. And over time, particularly if that goes on for a few weeks, that ends up causing some secondary pressure up through the spine. So there's usually a combination of physical and clinical signs that you find on examination, and you have to identify all of those and treat them appropriately. The treatment obviously is trying to realign and reorientate the joints and the associated ligaments to try and get the pressure off them, for one. The standard kind of palliative treatment for coccydynia is to use a ring cushion, and that's just simply a way of trying to take pressure off the coccyx. And whilst that is appropriate to do whilst one's trying to facilitate repair and recovery, it is also obviously important to try to make sure that the rest of the mechanics in the system have been restored to normal. So that's really where proper systematic examination and manual therapy has a role to play to help to realign the system and distribute the pressure properly. The other common feature you see is that when you get episodes of pain, the muscles around the region, in this case the gluteal muscles, the abdominal muscles, the hamstring muscles, the quads on the front, the tension in those muscles also gets disturbed. Some of them will become overactive and go into spasm, and others will become switched off and completely inhibited. So from a clinical point of view, it's very important to try to identify what changes have occurred in the muscle control as a consequence of the trauma, because that needs to be part of an integrated management plan. If the mechanism of coccydynia is pregnancy related, very often specific pelvic floor work needs to be incorporated, and that usually is typically a women's health issue. So there are specialist physiotherapists who deal with that area of pelvic floor rehabilitation, but it's surprising how commonly residual issues from pregnancy, like coccydynia and low back pain, and sometimes there's incontinence or pelvic floor dysfunction associated with that, and they don't get managed properly, sometimes because people are embarrassed, sometimes they aren't aware that there's specific treatment available for these kind of conditions. But they're not infrequent things to see clinically, and it is important to identify what components you can address and what need to be sent off for other kinds of treatment. If it's a pelvic floor issue, that's not my area of expertise, so I would refer out to women's health specialists to deal with that. But it is very, very common to see what you might term in general pelvic incompetence post pregnancy. And of course the worst case scenario is when you see people who have traumatic incidents, either car accidents or falls during pregnancy, because that really is a double whammy, where you have the hormonal changes of pregnancy, which make the ligaments lax. You've got muscle tone switching off, particularly in late stage, third trimester of pregnancy. So that makes everything loose and inelastic, or loose and excessively elastic, should I say. And then traumatic insult on top of that really can upset the apple cart. So they can be challenging patients to rehabilitate, and all of that usually with the confounding factors of a newborn to try to look after and manage and lift and carry and all of those other associated factors. So they're often cases we see which are quite challenging to get to settle, because it's not possible to rest and unload the tissues if you're trying to do normal activities of daily living. So those kind of conditions we see relatively frequently in clinic, and the point I wanted to share with you was that it is very important that the clinician recognizes all of the factors that are contributing to persistent coccyx pain, not just simply trying to unload the sore coccyx, which of course is very important to allow even simple things like just being able to sit comfortably and have meals and drive and move around. But it's also looking at the bigger picture to try and identify all of the variables so that you can integrate correct management from an early stage into your treatment regime. So I just wanted to share those thoughts with you today. I'll see you again on another video. Bye for now.